Welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we bring this podcast to you every Wednesday as a veterinarian, as a technician, as a dentistry team to help you be even better at veterinary dentistry in your practice. We're sponsored and partnered today with the Veterinary Dental Practitioner Program. If you're interested in being among the best anywhere in general practice as a team in veterinary dentistry, I invite you to request an invitation. Just go to ivdi.org/INV, like invitation, first three letters INV. So IVDI, International Veterinary Dentistry Institute, ivdi.org/INV, and we'll get you the information that you need. Beth, is there any correlation between dental disease and how quickly hyperplasia advances? Good questions. So extracting the teeth generally is going to eliminate the recurrence of the hyperplasia. And then with the correlation with hyperplasia and periodontal disease, yes, there is a correlation there. If you can do home care and you can get that patient back on a reasonable interval, you will in some cases, and probably many cases, you will slow return of the proliferation of that tissue. If this is one of those drug-induced cases, that's probably not going to play that much of a role. We had a question about cyclosporin. We had a question about amlodipine. And those are a couple of the drugs that we mentioned that do induce hyperplasia. Once those drugs are stopped, or you wouldn't want to just stop amlodipine, or probably wouldn't want to stop cyclosporin either. You'd want to have some alternative medication that you could use. But once that's stopped, and some of those cases will regress a little bit, and definitely if you go in and you treat that, then those cases will not return as long as the patient's not on the medication, as long as the medication was the original culprit, which if it wasn't a breed that's predisposed to that, it's probably the case. If it's a predisposed breed, you could certainly have both going on, and it would come back after stopping the medication, but they would need to have both components there. There's no way to tell that until time has had a chance to allow regrowth, so you would want to recheck that at some point in time. The other question is, how do we prevent trauma to the lips by the canine teeth when we extract, do mandibular canine extractions or maxillary canine extractions? So what will happen is, once we extract a maxillary canine, in some cases the mandibular canine tooth will impinge upon the lip, either entrapping the lip so that the canine tooth ends up outside of the lip itself. In other words, that if you look at the cat with its mouth closed, you would see the tooth and not just the lip. And usually the cat's going to do some kind of manipulative tongue movement to get that where it's not entrapped like that. But more commonly, what would happen would be that mandibular canine tooth would impinge upon the tissue on the mucosal side, not on the outside, but on the palatal side, or the mucosal vestibular side. And in that case, what a lot of people do, if you have the capacity to do this, is to take that tooth down a little bit with odontoplasty, making sure that you don't go into the pulp, and then do a bonding of that tooth with bonding agent and a light cure. And, most of you don't have that. So it appears that, based on the experience of our academy members, that does happen with fair frequency, and consequently it's a good idea to do that. The alternative is that generally it's not a problem for the patient. It doesn't get that bad where there's ulcers or there's other changes. There's just maybe erythema without severe changes or problems for the patient, and that generally resolves in 6 weeks. So it doesn't appear that most of the time that's a permanent problem. It's generally a temporary one, but if you do have the capacity to do bonding, that would be one way to do it, as long as you're comfortable with how much you can take. And that's something that you just have to be real careful of when you're doing that. You do not want to get into the pulp, because then you're going to have a root canal on your hands that you're going to have to refer for that. So in general, if you've not done this in a lab and know how much you can take, in most instances, you don't want to do that. So for gingival hyperplasia, what have you replaced the high-speed fluted bur? Fluted bur is unavailable. What do you use? In other words, the best answer to that is that was a problem for us. We could not get the 12 fluted bur for a long period of time. And lo and behold, when we were starting the instrument website, we had a bur manufacturer that we searched for and found that had a number 12 fluted bur. So fortunately, we have that, and it is on that Dr. Brett's Pets website. And what you would do here is you would go to, if you look at the menu there in the green at the top where the white is, you've got Home, Instruments, Equipment, Burs. Just click on Burs, and it will take you to that 12 fluted bur, and you can order that through directly online through Dr. Brett's Pets. Good question, Christian. What speed are we using when we use 12 fluted bur on the gingiva? The answer to that is you always use a high-speed handpiece for anything that you're doing with bone, tissue, or tooth, and you always have the foot pedal at its highest, its maximum. You have that foot pedal depressed at its maximum, so that bur is spinning at its maximum RPMs, and consequently is cooling that bur at its maximum. You do not want to spend a lot of time on that tissue, as I mentioned before. You want to have it always on the highest setting. You never want to have it lower than that setting. Christina, she does this with a CO2 laser. I've not used CO2 laser, but I know it can be and is effectively done with a CO2 laser. Again, you want to make sure you're using the correct setting on that. I have observed beautiful, long-lasting outcomes, and in some cases do not ever have to redo it, although I may have lost some to follow up after the first 2 reset sessions. It will come back in most cases, whether you use CO2 laser, whether you use the 12 fluted bur. Most of those are going to come back with time, so you want to definitely recheck those back. So Marjorie, some epulids look very aggressive and similar to acanthomatous ameloblastoma. Is the only way to tell to biopsy? Yes. You can get some that look more like acanthomatous, that many times are, but you cannot tell by looking. You definitely need to biopsy, and so keep that in mind always. With any oral mass, biopsy before you do a definitive excision. What do we use to stop the bleeding? Generally, you don't need anything in most cases. We use Hemoblock in some instances, and again, Dr. Brett's Pets has that Hemoblock on that site, so it's real easy to order that. If you go, and if you guys would put the URL in there for that. Hemoblock is like it's made from potato starch, and it can be placed anywhere in the body. It doesn't necessarily, it's not just confined to the oral cavity. It can be used for hemostasis everywhere. It comes sterile, so you wouldn't want to use it when it's not sterile. If you're doing a liver biopsy or you're doing some kind of abdominal procedure or otherwise sterile procedure, but you can certainly reuse it if you've used it in a sterile procedure, as long as it's not contaminated with blood or otherwise. in your oral surgery cases. Again, you want to take radiographs, and you want to make sure that you do that just all the time. If you've got lucencies adjacent to the mass, in other words, you've got less bone than normal, you might have an ameloblastoma or some other mass that's more aggressive. So you want to just don't rely as much on the whether you have changes radiographically or not. You're going to get a diagnosis in almost every single case, if not every single case, just by taking that soft tissue. But you definitely want to know whether you have bone loss or other problems there, so you definitely want to take radiographs. I hope you enjoyed that episode. If you'd like more information about the Veterinary Dental Practitioners Program, please submit to request an invitation at ivdi.org/INV.